like to welcome you to this presentation, which I hope will be of great value to you in a very practical way. You know, at St. Matthew's House, we're always looking how we can improve the lives of people, those in recovery, those that are in our shelters, our organizational staff, and everyone, and the community at large. How can we really create a healthier community? And now, of course, with this whole COVID situation, and now moving through the flu season, there's a lot of concern, obviously, about how we can protect ourselves and our families. And the information that I want to share with you in this presentation, as I say, it really comes from a lot of the research that is now being done around the COVID situation, though I'll be getting into some other issues as well. So this is about COVID, seasonal flu, and fortifying your immune system. And this is an educational program, so anything that I'm sharing here, of course, you'd want to check with your own doctor before implementing anything. We want to say that. So the basic strategy that we've taken, for COVID based on the healthcare, public health authorities has been to slow the spread, flatten the curve in order to prevent the hospital system from being overwhelmed. And fortunately, here in Southwest Florida and in many other areas of the country, this basic strategy has been very successful. And what we want to do is build on this success. The key point is to balance our legitimate concerns regarding COVID with the need to reduce unwarranted anxiety and stress. So I hope that this presentation will be of help to you in that regard. Now currently, as you know, there are great efforts, a lot of resources, a lot of energy being devoted to finding better and better treatments for those that are seriously infected with COVID, finding vaccines that would be safe and effective. And of course, this is where largely the public health community and the research community is devoting themselves. But hardly, what we hear hardly discussed at all. What really is barely mentioned in the media are all the ways that we can improve our God-given immune system, which is the way that God gave us to protect ourselves against infection. And it's so important that we really understand what we can do personally and in our own homes and with our own families to improve our immune system function and thereby reduce the risk of serious infection. So how do we fortify the immune system? How do we go about actually doing that, accomplishing that? Well, I think that there are basically three things that we would want to understand. First of all, to create a more robust immune system, a lot of it has to do with basic lifestyle factors. In addition to that, the whole issue of stress. Stress really depresses the immune system, so we would really want to understand effective stress management and stress relief strategies that would help with this issue of having a stronger immune system. And also there are specific nutritional supplements that have been proven to make a difference. Now, for this presentation today, I'm going to focus specifically on the nutritional supplement issue. And maybe for other classes, definitely for other classes down the line, I'll be talking more about a healthy lifestyle, about stress relief. But today I want to really focus on what we can do in terms of specific nutritional supplements, and most especially vitamin D. Now, if you look at this illustration, you can see that in the bottom here, as we move from left to right, moving from lower to higher vitamin D levels, then there's a decrease in the incidence of many health problems. High blood pressure, heart attacks, bone problems, here's influenza, type 1 diabetes, various cancers, kidney cancer, breast cancer, colon cancer, multiple sclerosis, we see that many, many health challenges are associated. There's a decrease in the incidence of these major health issues as a result of increasing the level of vitamin D in the blood. Unfortunately, at least 40% of our population has a significant vitamin D deficiency, as defined by a blood level of below 20 nanograms per ml. It's a little bit technical, but you remember the number 20. So 40% of our population is below that 20 and is considered to be deficient. However, beyond deficiency, there's what we know as insufficiency, meaning that you're not deficient, but you don't have the full amount that you would need to get the maximum effect, the maximum benefits from vitamin D. And when you consider not only deficiency, but insufficiency, 90% of the American people are thought to be vitamin D deficient or insufficient when compared to the recommended level of at least 40 nanograms per ml, which is twice that deficiency level. And this is affecting children as well. Only 9% of children and teens are in the recommended ranges for optimum vitamin D levels. Now here we have some very important statistical information, which is looking at the association of a dramatic decline in death rate from COVID as a result of, again, increasing the vitamin D concentration in the blood. And so we have, in a way, like two major epidemics that are kind of colliding with one another: the COVID pandemic, but also the vitamin D deficiency, which is frankly worldwide. And so as vitamin D levels are increasing to optimum levels, the COVID death rate is declining. So this association is very, very important for us to understand. And there's a lot of research that's coming out now as a result of the COVID experience. More and more associations with the benefit of vitamin D. Here's one that looked at vitamin D deficiency as a risk factor for COVID hospitalization, for disease severity, and for admissions to the ICU units. So clearly, in each category, the risk was significantly increased if there was a diagnosed vitamin D deficiency. And here's a study from Indonesia, which again is making the same point. The percentage mortality was close to 99% with people that were low in vitamin D. But as the vitamin D levels increased and you got to higher levels, the percent of death from COVID was dramatically reduced. Here we have some research in the journal Nutrients just this past April, which was looking at vitamin D to reduce the risk of seasonal flu. And they said here the evidence that vitamin D supplementation could reduce the risk of influenza and COVID infections and deaths. So here, this is very, very much appropriate for the time that we're in now, COVID, seasonal flu, and what we can do to fortify our immune system with vitamin D. But beyond fortifying the immune system, there's also increasing evidence of the value of vitamin D to reduce the risk of cancer. Here we have a study 2 years ago. Breast cancer risk was markedly lower, again with higher levels of vitamin D. Going from that deficiency level of 20 to 60, there was a markedly reduced risk of breast cancer. And here we have research looking at vitamin D in type 2 diabetes. And just taking a quotation from the research, results add to the growing body of evidence supporting the association between higher levels of vitamin D and a reduced risk of type 2 diabetes. Higher vitamin D status has also been associated in other studies with a reduced risk of type 1 diabetes, cancer, heart attacks, MS. And again, this is just so important for us to understand. A reduced risk of type 2 diabetes. With all of the food supply being so processed and many different issues around our nutritional status, when we really look at the number of people that are dealing with diabetes or prediabetes. Prediabetes means you're not yet being diagnosed with diabetes, but you're on the path towards diabetes. When you look at type 2 diabetes and prediabetes, it's now upwards of close to 50% of the American population. So the fact that we have, just with a vitamin D supplement, tremendous association between higher levels and reduced risk. This is so important for our community. Also, vitamin D deficiency in this particular study as a risk factor for dementia and Alzheimer's disease. Once again, the same point. With vitamin D, there's an association between low levels of vitamin D and both dementia and Alzheimer's disease. And here we have vitamin D as an effective treatment approach for drug abuse and addiction. This was 7 years ago. And they're talking about providing a new direction towards a new treatment approach for drug abuse and addiction. So this shows how important it is for us to be able to have adequate levels of vitamin D, way beyond deficiency, overcoming insufficiency, and really being at the levels in which we can get this kind of high-level protection. Now, we're not going to be able to eliminate the risk entirely, but we can diminish the risk significantly. Now, why do we have that vitamin D deficiency and insufficiency? Well, one reason is because the food supply has been so processed and refined that a lot of nutrients that normally would be in fresh whole food is just not there anymore as a result of the processing and all. And also there's the widespread use of sunscreen, because we are so afraid of skin cancer. People are afraid to get direct sunlight. As a consequence, people are using sunscreens to such a degree that we're really not getting the kind of exposure to sunlight, which is one way that, probably the primary way in which God intended us to get our vitamin D levels at the optimum level. And aging skin will also reduce the amount of vitamin D that a person can create. Also, certain diets that are very restrictive of animal products, this can also be a factor. Weight issues. And people of color, our African American population, because the melanin, which God has given the people of color to protect them from the overexposure to the sun. That means that there's going to be much less impact of sunlight on the production of vitamin D. So only 16% of black adults have sufficient levels of vitamin D. This is very, very important for our communities of color. Now, the most natural way to get enough vitamin D would be through direct exposure to the sun. And to maintain healthy blood levels, we would want to aim for 10 to 15, maybe up to 30 minutes of midday sunshine in more than the face and hands for about 3 to 4 days a week. That would be the optimum way in which we could get the optimum amount of vitamin D. And it really should be the midday sun, not earlier in the day or later in the day, but when the sun is at its high point. And up to 30 minutes, because we don't want to get the overexposure. We don't want to get the risk of skin cancer like melanoma, this kind of thing. So if you're planning to stay in the sun for a while, it's best to apply the sunscreen after 10 to 30 minutes of unprotected sun exposure to help prevent sunburn and to reduce the risk of skin cancer. Now, what I say here is that unless you're spending sufficient time midday at the beach, or maybe eating 30 ounces of wild salmon a day or downing 10 tablespoons of cod liver oil, doesn't sound like much fun, supplementing with vitamin D3 is essential. It's safe, it's easy, it's inexpensive. So let's take a look at how much vitamin D you might need to take in order to get to those higher levels of benefit. In the journal Anti-Cancer Research 9 years ago, they commented that the Institute of Medicine, which sets the recommended daily allowance of vitamins and minerals, they recommended 600 units, international units of vitamin D a day, 800 international units for folks over 70. To prevent rickets, which is the way that vitamin D was discovered 100 years ago, And that level of 600, or for the older folks, 800 units per day, is so that you avoid being in that deficiency level of below 20 nanograms per ml. But researchers that are really looking at the impact of vitamin D on health, for example, at the University of California, the San Diego School of Medicine, the Creighton University School of Medicine in Nebraska, they found that markedly higher levels of vitamin D by adults in the range of 4,000, in this particular research they were saying 4,000 even to 8,000 is needed to reach the level of 40 to 60 nanograms per ml to prevent or markedly reduce by 50% the risk of major health challenges. So most of the researchers that are really devoted particularly to vitamin D research, what they're saying is that they believe that where deficiency is below 20, 40 to 60 is the appropriate target for reducing by 50%, by 1/2, the major vitamin D deficiency related diseases. That is multiple sclerosis, autoimmune disease, cancer, obesity, type 1 and type 2 diabetes, high blood pressure, heart failure, inflammatory bowel disease. And so when we look at these levels and what's required at these levels, according to the National Institute's, the National Health and Nutrition Examination Survey of the CDC, they found that only 10% of the American population is at a level where they could get this 50% reduction in risk of these major health challenges. That only 10% of the population is at the level where they can get the maximum benefit from the vitamin D. So what are the action steps here? Well, the ideal would be to have your doctor check your vitamin D level. Then you know where you are now, and you know where to kind of how much vitamin D to be taking so that you can retest in 3 months or so and be able to make sure that you really have gone to the higher level. So you want to have your doctor ideally check you and your family's vitamin D level, the 25 hydroxy vitamin D. That's important because there's another vitamin D test which is easily confused, and you want to make sure it's the 25 hydroxy vitamin D. And then you would discuss with your doctor about supplementing with 4,000 or 5,000 units a day or whatever would be appropriate in your particular case. It might even be higher at first if your vitamin D level is very low. You would go for a few weeks on a higher dose and then bring it down to maintain it at that better level. But the only way to really know this for sure would be with vitamin D testing. So there are some additional nutrients which work with the vitamin D to, again, fortify immune system function. Magnesium, vitamin K2. Vitamin K is, you don't want to be taking vitamin K2 if you have any kind of if you're on a Coumadin, blood thinner. Again, you want to be checking with your doctor. But all the others, magnesium, vitamin C, zinc, and then omega-3 essential fats, probiotics, these are other supplements that one could consider to really kind of add additional layers of protection. So I'd like to conclude with this scripture because, of course, here at St. Matt's we're faith-based, and we know that God is really always looking to help us and protect us and promote our health and well-being. So I want to thank you for your watching this video. I hope it will be of great help to you and your family. If you have questions, please be in touch with me, Dr. Bill at stmatthewshouse.org. And I look forward to other informational sessions that we'll be doing in the future. Thank you, and God bless.